It's already live.
कैंसिल कर ली कैंसिल कर ली वापस स्टार्ट करो इधर ना लाइव लाइक दिस
Hari, good afternoon. Hello and namaste to everyone out there. I hope you can hear me. And welcome to a
Yes.
session on low AMH. How to go ahead. We're pleased to have Dr. Suyash Bhandekar among us to educate us on the topic. And he's an infertility specialist, and he's going to be enlightening us on the topic at hand. We are really pleased to have him as a guest. That's on topic. Okay, go ahead.
Thank you so much. Thank you for the warm welcome. I'm Dr. Suyash Bhandekar. I'm a practicing fertility consultant at Apollo Hospitals, Thane. Today we'll be talking about a very important and interesting topic, that is low AMH. So why I chose this topic is like I have been seeing many girls, young girls with very low AMH levels. Like almost in every day we see like 3 to 4 girls who are having an AMH of less than 1 or less than 1.5, and that is a matter of concern. So hence I thought of talking on this topic because this is really important. So as just as we do a semen analysis to assess the fertility of a male, so in comparison to that, we do this ovarian reserve testing, that is a AMH, to know the egg quantity and the quality of eggs that the lady has. All right. So this particular level, the ovarian reserve, is on a declining trend. We don't know why exactly this is happening, but this is actually happening. So what is an AMH? So basically, it's a glycoprotein hormone. All right, it's just a marker of your ovarian test. And see, we all know that yes, every girl, she has a fixed ovarian reserve. She is born with a certain amount of eggs in her ovaries, and every month she is ovulating, and a particular cohort is depleting from her end. So yes, that particular ovarian reserve is highest whenever she hits the puberty, whenever she gets a periods. Gradually it decreases as her age advances. Yes, it goes decreases more after the age of 30 and significantly decreases after the age of 35 years. So in contrast to that, in just to giving you an example, whenever I have a girl who is around 20, 22 or 25, she's going to conceive very easily. Whenever she is hitting that 30 age mark, the fertility potential decreases. Yes, she will conceive, but she may take time. And once you hit that 35 years benchmark, post that, the pregnancy rates decline a lot. And that is not only because of your age, that's because of your ovarian reserve also decreases. Your uterine capacity to hold the pregnancy, that is the implantation, decreases. So hence, this is the importance of an AMH. So how do we measure this AMH? It's just a blood test. It's a simple blood test. It can be done irrespective of your periods. There are certain tests which indicates yes, you have to do it on your periods, day 2 or day 3 of your periods, because that time your hormone levels are at baseline. But this test you can do at any point of the time and the levels are constant. And the good part is you don't have to be fasting also. You can do it irrespective of your fasting status. Even if you have had your food, you can still do it. The values remains constant. So normally, what are the AMH values that we talk about? So if I'm considering a normal age girl, considering today's era, there are girls who get married after 20 to 30 and they plan a pregnancy after 30, like after 1 or 2 years of the marriage. So I'm considering that particular category of girls. So roughly around at the age of 30, I'm expecting their AMH between 2 to 4 nanograms per ml. Anything more than 2 nanogram is good enough. If it is like less than 1, it is low. And if it is like less than 0.5, it is very low. All right. So as your age decreases, as your age advances, this AMH level is going to decline. Unfortunately, what I am seeing in my OPD on nowadays is like there are multiple girls in their 30s, 31s, even at the age of 28 with the AMH of 0.5, zero point 0.4, zero point 0.8. And that is a concern. So, what are the causes of your low AMH? Frankly speaking, we actually don't know what exactly are the causes. Yes, there are certain factors that is definitely going to decrease your AMH levels. Like your, as I mentioned, your age. So, as your age is going to advance, so if I have a girl of around 37, 38, her AMH is bound to be like less than zero point 0.2 only, like around 1.5, 1.6 is a normal thing for her. Once she crosses 40, it would be less than 1. All right. Second is endometriosis. It is like a chocolate cyst in your ovaries, or what we call is कि महीने का गांठ हो गया है. So this is going to eat up your normal ovarian tissue, and this is going to decline your AMH. Third is a genetic history. So this is very important, especially girls whose mothers or elder sisters have got their menopause very early, like at the age of 38 or 40, they have got their menopause. These girls also have this hereditary trend. They will also have the same particular finding in themselves. So if their mothers have got their menopause at 38 or 40, they might also have it at the age of 38, 40, or maybe before that also. And that is alarming. Fourth most important thing is like autoimmune diseases, and this is on an increasing trend, like SLE, scleroderma, you are NA positive, or anything that is vitiligo that is going to hamper your autoimmune system. Even this is going to decline your AMH levels. There are other girls, subset of girls who have an ovarian surgery done in their childhood, just like an ovarian cyst. They might have a dermoid, they might have a hemorrhagic cyst, and they were operated. The ovarian tissue was touched, and yes, that is going to decline your overall ovarian reserve, that is your AMH. There are certain other factors which may also decline your AMH. Just like if you are smoking a lot or drinking and you are into drug abuse, if you are using phones and laptops in close vicinity, that radiation is going to cause a lot of decline in your AMH. There are certain environmental factors like pollutants or adulterated foods that is going to decline your AMH. And underweight or overweight, yes, that is it. Obesity is also known to decrease your AMH levels. So yes, once you got to know that your AMH is on a declining trend, what next? What are you supposed to do? See, unfortunately, we do not have any specific treatment to increase your AMH levels. That is beyond our control. This is genetically controlled. The amount of AMH is going to be remain the same, or it might decline over a period of time. There is no medicines that is going to increase your AMH levels. So whenever we have patients with this low AMH, they have only two concerns: why there is a fall of AMH, and how can I increase my AMH. I'm really sorry, there is no treatment for it that is going to increase your AMH levels. But yes, there are certain things that you can do, like just like lifestyle modifications. If you are into smoking, alcohol, drugs, you can just stop it. If you are overweight, you can just reduce your weight. Yes, we certainly give you certain medications like vitamin D, especially if you're vitamin D deficient, or antioxidants like coenzyme Q, fish oil supplements, omega acids, that is slightly going to improve your AMH levels. They are not going to increase the AMH levels, but yes, the maybe the rate of decline can be reduced to a certain extent. Second, which has been second medicine that has been extensively used is like a DHEA, dehydroepisteron acetate, and testosterone supplements, which might improve your AMH level to certain extent. But mind you, please do not take it under without a supervision of your doctor. Please consult your doctor first, because these medicines may also have a side effect. All right. There are certain modalities which are still in the experimental stage, like intra-ovarian PRP infusion, like the platelet-rich plasma. Secondly, stem cell transplantation, or also ovarian transplant. But these are all experimental, and yes, affordability is also a thing that we have to look out for. Coming to the next very important crucial aspect is that how do we plan a fertility, right? So yes, it completely depends upon the profile of the couple. So if your husband count is completely good, normal, your AMH is like mildly decreased, moderately decreased, you can still go ahead with natural planning. You might still conceive naturally. The only thing is, yes, we do not want you to take gaps. Like if you want to take a gap of 6 months, 1 year, or 3 years because of your education, or maybe your career opportunities are there, please plan your fertility first. You don't take breaks, otherwise, this particular AMH is going to decline. So you might try naturally, you might do follicular scans, and you can just find out your fertile window, and you can plan a natural pregnancy, and you might get pregnant also if your levels are good and other parameters are good. Second is, yes, you can plan an IUI also. So IUI is just like a modified natural technique. We introduce washed sperm during the time of ovulation, and that is also known to increase the fertility to some extent. Third and the most important is an IVF. Most of the cases with a low ovarian reserve need an IVF for sure. So in IVF, the most important thing is the stimulation part, the injections that we give. It's not the same injection that we give to any of the patients. You need some extra special type of injection to improve the egg quality to a certain extent. We cannot use randomly gonadotropins. You need recombinant injections for that matter. The only thing in IVF, yes, if your AMH is extremely less, because we have a lot of patients we are catering to with AMH of point 0.3, point 0.4, point 0.5, they need sometimes a dual stimulation. That is, we are doing OM pickup twice, we are creating a embryo pool and then using for an embryo transfer. Unfortunately, if this doesn't work, the only option that is left is using a donor. But I am not very keen on using a donor because, see, if you have even a slight amount of ovarian reserve, you should at least give yourself a try so that you do not have a regret anytime. Yes, using a donor, you have that option anytime. You can do it after 6 months, 1 year, even after 2 years. That option is still viable. But if you want to do it with your own eggs, a self cycle is needed, but with the right direction. uh, we have girls who do not plan their fertility. They don't want to have a pregnancy immediately. For them, I usually tell them to do at least egg freezing or embryo freezing if they are married. So in case if you are career oriented, you have a good career opportunity, but you're not looking out for a pregnancy and you have a low AMH, what do I do next? In that case, yes, you have a viable option. You just freeze your eggs, or in case you have married, freeze your embryos. You can use it later on after 3 years, 4 years, 5 years down the line. Maybe at that time your AMH is completely depleted, but yes, you have your embryos frozen with us. We can use them to give you a pregnancy, your self pregnancy, and that is important. So these all options can be mutually discussed with your physicians. They will help you to with what success rate can be is possible, what all viable options you have, and definitely your fertility can be easily planned in the right way. With that, I will say I am done with the topic. Any questions from your end are most welcome, and I'll try to explain them to my the very best. Any questions from the audience part? I think there are no more questions over here. So just to conclude, what I would recommend is, see, in case if you have a low MH, that doesn't mean that you cannot conceive. You can still conceive with your own eggs. The only thing which I would recommend is, in case if you're planning an IVF, which most of the girls may need with a low AMH, is like you need a proper stimulation protocol. I have a good, reasonable success rate in managing low images, especially in this COVID era. Because of this COVID, also there are many recent research papers which mentions that yes, your ovarian reserve declines because of this COVID infection also. So we have come across many patients, and we are giving them good results as well. The only thing is, yes, your stimulation protocol is very important, because it's not only the egg quantity, we need a good embryo quality as well. And secondly, an option of embryo freezing is always there for us. The only thing is, yes, you should always you should it's important to know where to stop. In case this particular thing is not viable for you, please stop. You should look out for other alternatives, like taking a egg donor or maybe an embryo donation. And you can also think of as adoption also. Even that is a good option. All right, with all this, I would wish you all the very best. Thank you so much for your patient listening. Take care.